question that came in was on strabismus surgery modifiers. And the person had asked, is that when coding two horizontal extraocular muscles, one right and one left, which is the proper way to code it? Are we going to use 67311 right and 67311 left? Or are we going to do the same thing, write the code once, 67311 with the modifier 50, which is for laterality, or is both variations acceptable? Same for vertical, which is just a different code, the 67314, right and left. And thanks in advance. So, you know, this was a really good question because we did have a lot of other conversations off of this in our forum. And I thought, you know what, this is a good one to put out there for our public webinar. And the fact is, let me just scroll down here. You can use both. It doesn't matter. Now, for the most part, I think you're not going to see the code written twice with the modifier right and left. You're going to see the modifier 50 put on there, but know that it really depends on what your payer wants. So it's kind of like the whole tomato. It just depends. But for the most part, it's probably going to be the modifier 50. It's easier to put one code on there with that modifier than to repeat the code. I did find this in the CPT Assistant Archives for 2017, and I left this small because I have a lot of information on here. It says the patient had surgery for bilateral rectus resection, a 5 millimeter with tendon, et cetera, et cetera. That really isn't the pertinent stuff. Is that does the code 68110, sorry, I'm getting buzzed by a fly, excision of lesion conjunctiva up to 1 centimeter, completely describe this procedure? And then the person goes on to say no, and then it says with modifier 50 appended if they do this on both of the eyes. So just to kind of give you a little additional information for your knowledge base, I went ahead and took the code, the 67311. This is strabismus surgery, and it's recession or resection procedure, one horizontal muscle. And I put a graphic in here so that you could see it and how they actually do that. The extraocular muscles is what controls the eye movement. Sometimes it's too long, sometimes it's too short, and so therefore you get the eye turning in and out. They can usually recognize this in a child pretty early. Sometimes the muscle's too weak and versus too strong or tight, and so they can go in and just adjust that quickly. I thought you might like to know, extraocular is the muscles too strong or it's too tight. So they do a recession of the affected eye. Okay, so if both eyes are affected, they'll do both eyes. If they do an extraocular muscle when it's too weak, they do a recession on the opposing eye, which is interesting, right? So then it goes on to tell you about how they do that. And I pulled this straight from Find a Code, which is kind of nice to have all of that extra information in there. I'm not going to read this for you. It's mostly in there for you to look at. So if you're in our club, you're able to get these answer sheets and look at them about how they actually do it. But wanted to show you this great picture that I found, and it shows you where the superior oblique muscle is, the superior rectus, the medial rectus. There's that lateral rectus on the side, and then you have the inferior oblique and inferior rectus. So it kind of gives you an idea when you see that, how it pulls the eye, the muscle around the eye. So if you're going to use these codes 67311, you're doing a recession or resection, and it's either the lateral or the medial rectal muscle. So here's the lateral, and the medial is right here on that, if you can see down in behind there. And then the 67312 is you're going to do both the lateral and the medial rectus muscle of the same eye. Okay. And then 67314 we're going to do either the superior or inferior rectus muscle. So here's that inferior rectus muscle kind of wraps around, and then that superior is right here. There's superior oblique and superior rectus muscle right there. And then it goes on to 67316, where you're going to do the same thing, but it's of the same eye. So I thought it was kind of neat if you could see the codes and relate them to the muscle. It makes it easier to code these when you understand what's going on and you can see that. So the answer to the question ultimately is yes. You can do it either way, but the payer is the one that's going to make that decision for you. Give them I should say, give them a shout out, send them an email. We used to call them, but we don't call anymore. We just send them an email and see which they prefer, or you can just probably go online, but it's probably going to be modifier 50. It's just easier to do it that way.
Do you need more medical certification and business training? Learn more at www.cco.us.